Hi, my name is Dr. James Lee. Today I'll be talking about what a mommy makeover entails. A mommy makeover is basically a combination of breast surgery and abdominal surgery done at the same time. So the goal of this is to restore a mother's body to what they were like before pregnancy or before bearing children. Common procedures that are done on the breasts are breast augmentation with silicone implants. This is to restore the breast volume and the upper pole fullness that were lost during breastfeeding and pregnancy, as well as mastopexy, also known as breast lift, and that's just to restore the areola or the nipple position to where they were before pregnancy. Breast augmentation and breast lift together can be combined into something called a mastopexy augmentation, which is basically the both procedures being done at the same time. So it's not a different surgery, but it's just for some candidates, they require augmentation and lift. Common procedures that are done in the abdominal area are liposuction or tummy tuck, or a combination of both. So tummy tuck will remove the excess skin and any stretch marks below the belly button area, whereas liposuction will remove the fat. Some patients are candidates for liposuction alone. That's assuming that they have not too much fat to remove and good quality skin, and they're not bothered by any stretch marks or don't have any stretch marks that they want to remove. Tummy tuck is a good procedure for someone who has loose skin, maybe not that much fat excess in the abdominal area, and someone who really wants to get rid of the stretch marks below the umbilical area. So lipoabdominoplasty is basically liposuction and tummy tuck at the same time. So certain candidates have excess skin and stretch marks below the belly button that they want removed, but also have some subcutaneous or fat underneath the skin that they could pinch on the upper abdomen. So these candidates are good for liposuction and tummy tuck at the same time. So diastasis recti, which is just a fancy way of saying that the abdominal muscles have been split. So the abdominal muscles, which the six-pack muscles, are two strip muscles here, and in between there's a fine line before pregnancy. But during pregnancy, because the abdomen becomes quite large, that has to accommodate the space for the growing child, the abdominal muscles are widened, so the space between the muscles are stretched. In between those two muscles, it's just something called fascia, which is like a tight mesh, so it's not muscle. So unfortunately, if you have some degree of diastasis recti, or the separating of the muscles, no amount of dieting or exercise will be able to close that gap. During abdominoplasty, since we're able to access those muscles, we're able to do what's called plication, which is repairing the muscles back to their pre-pregnancy state. So patients often ask, what is recovery like after mommy makeover? So the recovery is definitely going to be a little bit longer than if you did just the abdominal procedure or just the breast procedure. However, you will only have one recovery period rather than going through two separate recovery periods. Mommy makeover is big surgery, so you do need to be prepared to recover well, give yourself enough time to heal, and have ideally some help at home for the first few days after surgery. It's big surgery, but it's a big transformation. So the transformation after a mommy makeover surgery will be immediately apparent when we remove the first dressing. However, like any other surgery, the final results will be seen at about 1 year after the surgery. This will give your body time to decrease all the swelling and the scar to mature. I hope this video was informative, and I hope I was able to answer some of your questions. For more information, feel free to visit our website or call the office for a consultation. Of course, since there's so much variability in mommy makeovers in terms of how much skin, how much fat, what the aesthetic goals are, every patient is unique, and so the best way to assess what is needed during your mommy makeover is an in-person evaluation. Thank you.